Find out why men are less prone to developing thyroid disorder as compared to women.
And how to manage your overall well-being when hormonal imbalance hits big time.
All that and more on Everybody Knows.
Imagine if you're constantly running on empty or have a brain fog, and that's the order of the day.
Or your heart is racing so fast that it exceeds 100 beats per minute even while you are at rest. And you're constantly feeling jittery, anxious, or easily upset.
Oh, welcome to Everybody Knows. I'm Catherine Robert, and it's indeed no laughing matter when your body and mind are subjected to fluctuating levels of distress, weariness, and unease.
And I'm Mike Kasem, and joining us to share all we need to know about thyroid disorder is Dr. Vikram Sonawane. Hi, Dr.
Welcome.
Vikram. How are you?
Hello, Mike.
Hi, it's nice to meet you.
Nice to meet you all.
First of all, where is the thyroid gland?
Okay, basically thyroid gland is like a butterfly-shaped gland.
Okay.
And then everybody's thyroid gland is like a shape of their thumbs. So Mike's will be this size, mine will be this, right and left, okay? And if you see, this is our Adam's apple and this is our trachea. And wrapped around the trachea is your thyroid gland.
Oh.
Okay? It's a butterfly-shaped gland of thyroid gland. It's right here in our neck,
so it's
right?
Okay.
With the shape of your, like the shape of your thumb, the right side and the left side.
And it's attached, though. It's all one piece.
Yes. So it's like this.
Interesting. That's so what happens when this little butterfly there starts to get inflamed and agitated, irritated? It can't flap its wings, maybe. It can't go.
So basically, it's a small-looking gland, but it's a powerhouse, okay? So this gland is responsible for all of our metabolism. So the way we produce our heat so that we don't feel cold, it makes your heart pump the way our heart rate is maintained by this.
This little thing does all that?
All this, the hormone produced by this gland, thyroid hormone, is responsible for all this effect. If suppose you have this hormone deficiency when you are a small kid, may affect your bone growth. And then if not adequate amount, it can cause a lot of problems, including infertility, weight gain, and so on and so forth.
Okay, so my question is, what are the main causes of thyroid disorders?
Hormone has to be in balance. It has to be in harmony so that if it's high, it's called hyperthyroidism. And if it's low, it's called hypothyroidism. Most common causes of overproduction is the autoimmune attack. That means the antibodies, your own antibody attacking the thyroid and making it produce too many thyroid hormones.
So it's specifically attacking the thyroid?
Yes.
So there are situations where it's not attacking anything else yet. It's attacking this, then it's producing the hormones.
Yes. Unfortunately, certain patients, it also has affiliation towards the eyes and the skin. So if you see on the left side, our eyeballs are like a small socket in which the eyeball is there, and then the nerves and the arteries are there, along with the muscles which help us to move our eyeball. But if these antibodies try to attack, the fat inside the eye socket increases, and as the result of this, the eyeballs are pushed upwards, and then the eyes become very staring. Fortunately, it's very mild form most of the time, but in a very severe condition, it may restrict the movement of the eye, so the people start to see double vision. And extreme condition, they may lose the vision also.
Okay, I have a question. Do you want to meet some hot celebrities?
Yes, of course.
All right, let's go ahead and invite our guests out. He is a versatile artist and a fitness buff who's happily married with 2 beautiful kids.
And she's a fiercely resilient actress who knows what it's like when the going gets really tough.
And she's a world champion deadlifter. No?
Is she?
Okay.
No.
Let's welcome Daren and Priscelia Chan.
Come on out, guys. Hello, hello. Hello, hello.
Hi, nice to meet you.
Hi.
Hi, Mike.
All right.
Oh, okay,
Hi, doctor.
good. Okay. Oh my goodness, I don't know if you guys heard what we were talking about, because thyroid sounds like
Sounds terrible.
serious business, right?
Yeah, sounds tiring.
It is very serious business.
Especially women, yeah.
Yeah, especially women, which is so unfair.
It seems like that's a kind of a ongoing theme on the show. It's like these affect women a lot more than
Yeah,
men, right?
yeah. So give us less headache, Mike. So, Daren and Priscilla, we have a few items here.
Okay.
Right? So we want to know which of these items do you think represents the emotional state of people who are suffering from thyroid problems?
So we got puzzle with missing pieces, ball
We've
of
got,
yarn.
Yeah, we've yarn, we've got mirror, got pins and needles, and we've got candles. So I'm guessing like heat and fire.
But
Okay.
I'll choose the ball of yarn.
Ball of yarn. I would say pins and needles, to be honest.
I would say candles
Really?
and fire.
Wow.
Oh, burning.
Yeah.
That burning sensation?
Yeah, I think so.
What about you, Mike?
I'll go with
What's
the,
left?
I'm with the ball of yarn. I know, I'm with the ball of yarn. I
Okay,
think, yeah.
okay.
That makes sense to me, like it's all tangled up.
Yeah.
Yeah.
State of
Doc.
mind.
Doc?
Which one of us is right?
Who chose the puzzle?
Nobody chose
Nobody
the
chose the
puzzle.
So we're all wrong.
It's the puzzle.
I chose puzzle because you can fit into both hypothyroidism as well as hyperthyroidism. Because certain symptoms are puzzling, confusing, and then you may think that's what's going on. So I thought puzzle may be the very
Okay.
close to relate to.
But none of these other things, not the yarn, not the pins and needles.
Well, he may be right.
Yeah.
He chose the
I chose the candle and
so
because I thought fire is like related to like, thyroid, you always feel like hot.
hyperthyroidism, yes, you develop heat intolerance and you sweat a lot and you can't really. When other people are, on aircon with the temperature set at 16, they are feeling very cold, and then this person doesn't feel cold at all.
But what about the state of mind? Do they feel like states of confusion, anxiety, helplessness, and that's why I relate it to the ball of yarn?
Yes, so fogginess, you will say.
Yeah,
so
scary.
basically, brain fog is real. Sometimes you just can't concentrate, or you're watching some movies and then suddenly you realize that you lost, what I was watching. After 15 minutes, you can't relate. So all this cognition is mainly also thyroid dependent. So hypothyroidism does cause extreme tiredness and fatiguability. But of course, remember that other conditions like low hemoglobin and all also can cause anemia and extreme fatigue. In females, because they have a menses, one of the signs in hypothyroidism will be they will have a very heavy menses, lose a lot of blood, and then they develop anemia. So to add to their extreme tiredness and fatiguability from the hypothyroidism itself, because of anemia, it gets worse with the hypothyroidism and anemia.
So, Dr. Vikram, how detrimental can it get for our overall health well-being if thyroid disorder is not left unchecked?
Both can cause extreme amount of damage to our body system. So suppose if you have a hyperthyroidism and if you really don't bring down the thyroid hormone levels, your heart is beating like a horse, and you keep on flogging the horse, then we develop thyrocardiac disease. That means your heart suddenly, after a while, working so hard, give up. And then you may develop heart failure and all. Okay. It can cause sometimes irregular heartbeat. Suddenly they can faint and all. So this is very important that you get your hyperthyroidism corrected as soon as possible. So most of the time, if we notice that the problem is the overproduction, then the treatment will be to lower the production. If the symptom is hypothyroidism, then you replace with the thyroid hormone. Initially, all these things will be managed by medications. In a very rare situations where we need to do surgeries, where you have to remove the thyroid gland for achieving
Then
the
you go
goals.
for
What do you do when you remove it? Like after that, then what?
You say goodbye to the butterfly.
That's that.
But you need it to regulate things, right?
Yeah, then you replace the thyroid hormone by taking the thyroxine. Usually, you will take one tablet every day, and that should be enough, and it will not fluctuate your thyroid hormone levels that
Well, let's
much.
get rid of the thyroid then, right? Just get rid of it.
Right,
think
Dr.
it's
Vikram, I have a question for
Yeah.
you, right? So we have two types of thyroids, right? Which is hyper and hypo.
Yeah.
So what's the distinct difference? And I believe it kind of affects the weight as well,
Yeah.
somehow, right?
Exactly, so low body image problem happens in hypothyroidism because, first of all, they feel very depressed, and then at the same time, their basic metabolism rate has gone down, and then they keep on putting weight. Then they say, I'm doing dieting, I'm doing exercise, everything, and still I'm gaining weight. In hyperthyroidism, they're constantly hungry, and they eat a lot, and they still lose weight.
Right.
That's hyper.
That's hyper.
A lot of people want that, right?
Yeah. I don't mind that, that's okay.
Is there an age group that we are looking at where most of the people are more affected by it?
It's most commonly affected females in a young age group as compared to males.
What age are we talking about, Doc?
Less than 40, I will say.
So you passed the 40 barrier, which you haven't yet, of course.
Okay, so less than 40 and you need to get it checked. Is it
actually,
annually?
That's just an average, right?
That's and just average, yes.
Okay.
I'm just saying that, if you have weight gain, weight loss, of course, which is excessive, females, if they are having difficulty in getting pregnant, then they should get a thyroid check because it does affect fertility. So these are the common conditions in which you should seek attention and take the doctor's advice on this.
Hey guys, speaking about weight,
Right.
you're gonna have to wait just a little bit because we're going for a commercial break. When we come back, you're gonna find out how a mother of 2 young boys copes with the upheavals of hypothyroidism.
Welcome back to Everybody Knows. Now, in spite of a consistent efforts to lose weight after giving birth to her second child, marketing executive Aparna Johari could barely shed an ounce. What's worse, she was constantly feeling down and tired and couldn't bring herself to do anything else other than what's absolutely required.
Now, her overall health and mood, as well as self-esteem, were adversely affected, and she only managed to gradually pick herself up when the cause of her lethargy was diagnosed and treated.
I was always feeling fatigued and my energy level was very low. And I think what was worse was I started to feel very depressed.
38-year-old Aparna Johari is married with 2 kids, aged 2 and 5. After her first child was born in 2019, the senior marketing executive began to experience symptoms which put her in a constant state of agony and doldrums.
I had difficulty waking up in the morning. I wasn't very fresh or, ready to start the day. And when you have young children who are waking up early, you really want to get up and have that energy level and play with them even throughout the day and then put them to sleep. People would look at me and they would look at my face and they would tell me, like, you look so tired all the time. Previously, we would at least step out in the evenings or go out in the night, but I think specifically during that period, I just did not want to go out in the evenings because I feel lethargic. I think it affected our social life quite a bit because I just wasn't willing to sacrifice my evenings. Thyroid does make you feel like, other than low energy and stuff, it just put me, I don't want to use the term depressed very loosely, but I was pretty low. I realized my hair was just, it became really, really thin and I was losing lumps of hair in the shower. During pregnancy, I was diagnosed with like early gestational diabetes, but my sugar levels were okay, but at the same time, I had a lot of cravings for sugary food and I guess that scared me.
Despite her efforts to lose weight and keep in shape, Aparna found that even shedding an ounce of body fat was an uphill task and losing battle.
Pre-pregnancy, my weight was between 50 and 53, and I was suddenly 63 2 years after delivery, and I could not lose the weight. And I started working out, and I was following a diet. I was taking care of myself, and even after 1 or 2 months, I felt like I hadn't even lost like a kilo. I started wearing loose clothes, baggy pants, baggy t-shirts, because I just didn't feel comfortable dressing up. So it did affect my self-image a lot. Like even in the mornings when I would try and get ready or for work and stuff, like I changed multiple clothes just to like feel what I'm comfortable in. I was doing a lot of reading on functional medicine and how they talk about like how you should understand what the root cause of an underlying issue is. And then I ended up seeing an endocrinologist where he did further testing, and he also did an ultrasound of my thyroid where he found out that it was a little inflamed and my antibodies were very, very high.
As her thyroid gland does not produce enough thyroid hormones, Aparna has to take medicine prescribed by her doctor every day with a slightly higher dosage on the weekends.
The medicines definitely helped. I feel like they helped with the hair as well a little bit. I feel like there was a little thinning, but it got better. Definitely my energy levels had also improved. And at the same time, I think Dr. Vikram also told me with a chronic illness like thyroid, you have to sort of navigate and maintain your lifestyle in a way where you are eating well. And the medications help me navigate my everyday life, but taking them for the rest of my life is, it's not an easy pill to swallow, but I do it every morning.
Oh, wow.
Wow.
Honestly, the emotional roller coaster ride that she went through is something that nobody will ever understand unless you absolutely go through it. And speaking of which, actually, Priscilla, you had to contend with eczema for about 2 years. Now, it is a completely different medical condition, but was that emotional roller coaster ride similar? Could you understand where she was coming from?
I can totally understand because I went through certain withdrawals also from medication. So it was so bad when at the worst stage, where we put our mask on,
Yeah.
it was all weepy and oozy and raw skin. So that was the worst stage.
Oh, wow.
So I can totally relate in terms of body image, how you look, and how it can be detrimental to your self-esteem. And unknowingly, it could be on the verge of depression. So it took me over 2 years
Wow.
to fully recover from within.
Gosh,
and had my immunity all balanced up.
Yeah.
Yeah, that's where all the symptoms were gone. So it's very different from what Aparna is going through, but I think I really feel for her when she mentioned that it's going to be a lifelong thing. Yeah, it's not easy. And I think that patience is much needed and the support from the family members is really very important.
Yeah.
Will she have to keep upping the dose?
Only under circumstances, we may have to titrate the dose. Don't worry too much about the dose actually, in thyroid, because it's a hormone replacement. It's not like higher the dose you take, higher the side effects. It's not actually. If you are taking 25 microgram and if I am taking 100 microgram, that does not mean that your thyroid disease is okay and mine is a little worse than you. Everybody's requirement of thyroid hormone is different. So is the dose.
Doctor, I have one question.
Yeah.
So just now I saw Aparna's video, right? So she tries to exercise. So if people with thyroid, are they supposed to exercise or are they supposed to avoid it?
It's a very good question. First of all, it will limit your exercising capacity itself. If the hyperthyroidism already affected the heart, and then if you have something called atrial fibrillation, that means the heart is not beating, it can be very dangerous. If you don't, you suddenly start to run marathon or doing very high intensity exercise, it may actually cause you a lot of problems. So first you need to fix thyroid problem, get the heart rate down, make sure your heart is okay, and then it's advisable that you go for these heavy exercises and all.
Is there a cause? Can you bring it on yourself by stress?
Is it food? That's a good question,
Diet, right?
So fortunately, it's not something you do will cause, but having said that, there are some certain supplements, biotin, okay? It can cause, actually it doesn't cause the thyroid problem as such.
Okay.
But if you check the blood test, it will show that he has a very high thyroid hormone levels. The biotin interfere with the blood measurement. And you've been wrongly diagnosed.
My other question is, why are women more prone to this getting hypo or hyperthyroidism?
Actually, the simple answer is, first of all, as compared to males, females go through a lot of hormonal fluctuations because the menses will come, menses will go down, and then if not pregnant, then again the menses will come, and other hormone swings every month. Then comes the pregnancy, and then there is a postpartum period, and then there is a menopause. There is a roller coaster of hormonal changes. As compared to male, they gradually will lose their testosterone levels over a period of time, so they don't have these drastic fluctuations in the hormone.
You've got an easy life, Mike.
All men.
Because I have no testosterone.
All men.
Are you saying I ain't got any testosterone?
One more question, doctor. Okay, so one of the symptoms is brain fog, right? How do we actually know it's just being plain forgetful or is it really brain fog?
First of all, when we just feeling like I can't able to concentrate and all, may or may not be brain fog, but if it's affecting the quality of life, and there is objectively certain things you can do very easily, which you can't do. So recently I saw one patient who is a writer and she suddenly can't write anymore. And once the hypothyroidism was resolved, she was able to go back to what her norm is. So
Wow.
for her, that was a brain fog.
Right.
She can't even think.
So does it lead to like dementia or something like that?
No, dementia is totally different.
It's totally different.
But yes, hypothyroidism, hyperthyroidism can worsen the dementia.
Right.
But situationally, like once you clear that, then it should get back to whatever your dementia level was at.
Yes,
right?
your baseline.
Yeah, your base. That's a good word, baseline.
Baseline.
Hey guys, we're gonna be back. We're gonna take a quick break, but we're gonna come back and Dr. Vikram is gonna tell us much more about hypo and hyperthyroidism. Stay with us. Welcome back to Everybody Knows. Earlier, we were talking about hypo and hyperthyroidism, and a few of the symptoms for both conditions kind of overlap, and this makes the diagnosis a little challenging at times.
How to differentiate between these two is that, in the hyperthyroidism, you're anxious, you're very agitated, you're always trembling, and you are very, you can't rest at one place. And this is what causing difficulty in concentrating. Whereas in hypothyroidism, you are very fatigued and extremely tired to even focus anything. So, yes.
Right. So if you have thyroid, does it mean that you have a higher chance of getting a thyroid cancer?
Actually, the thyroid cancer usually is basically when we start to have a growth in the thyroid gland, and you see some form of nodule start to grow here.
Yeah.
Okay. But having nodule is very common. If I randomly do 100 people's ultrasound thyroid after the age of, say, 40 or 50, a lot of people will have nodules.
But having hyper or hypothyroidism wouldn't cause cancer?
No.
Okay.
Technically, no.
Okay.
Alrighty, now that we've learned as much as we could about hyper and hypothyroidism, I think it's time for us to play a game.
All right. Priscilia and I will be pitched in battle against Kat and Daren, and Dr. Vikram will be reading out the clues for us. Now, let's get the ball rolling.
Okay, so the first question is, this is the shape is often used to describe the appearance of the thyroid gland.
Butterfly is our answer.
That's correct.
Ding, ding, ding.
All right, two down.
This is the chemical process that occurs within the body to maintain life.
Photosynthesis. I learned that in school. Oh.
Metabolism.
Oh, very good.
Metabolism.
Okay.
Yes.
Okay, one of the thyroid hormones, also known as T4.
T4.
T4. Yeah.
Thyroxine?
Yes.
Oh, yep, that's the one.
Whatever.
Wow. Girl, what?
This is one of the symptoms of hypothyroidism.
Fatigue.
Oh, yeah.
Mike, have you contributed anything to your team?
I did the intro.
Oh, this is what the hyperthyroidism does to the heartbeat.
My team.
Repeat.
Yes.
Go ahead, take it.
Yes, we got it right.
All right, guys, that was fun. Dr. Vikram, thank you so much for being with us. We appreciate it. And hey, Daren Tan, Catherine Robert, thank you so much for joining us too. I mean, you're my co-host, so I don't need to thank you for joining us. Right?
No.
Thanks, Priscilla. Really appreciate it. Hey, guys, we hope you learned a lot about hypo and hyperthyroidism. And thank you so much for joining us on this very special episode. And it's special because these two are here. All right?
That's right. In the meantime, take care and bye-bye.